So we use a Braden scale to assess the pressure injury risk using factors like mobility and nutrition to score them. A lower score equals a higher risk. So any score less than 18 is at risk for a pressure injury. Remember, we assess the skin and the Braden scale at admission and at regular intervals throughout their stay in the hospital. Then we assess bony prominences and under medical devices because this is where pressure injuries tend to happen. If an injury is found, we do not massage the reddened areas. That can cause increased tissue damage. Instead, we need to document and determine the stage of the pressure injury. So for pressure injuries, I want you to think we start at the top layer of the skin and we get deeper and deeper with each stage. So for stage 1, think the skin is intact. We see non-blanchable redness like this, so it's red, and when we push on it, it stays red. Remember, it's okay to push on skin to test if it's blanchable or not. It's not okay to massage reddened areas. That's what causes tissue damage. Stage 2, we're seeing partial thickness loss. So we're taking off that top layer of skin and the skin is no longer intact. Then we see a shallow wound or blister like we see here. So now we're at stage 3, we're even deeper to the subcutaneous tissue. We see full thickness loss with visible subcutaneous tissue like we see here. So at stage 4, we're at the deepest level and we're seeing full thickness loss with exposed muscle, tendon, or bone like we see here. Now we're at instageable pressure injuries where we see full thickness loss, but we see slough, which is that stringy yellow substance, or eschar, which is that necrotic tissue. It's in the way of that wound bed and we can't stage it. Therefore, this wound must be debrided before we can stage it. So for our deep tissue pressure injuries, it's like a giant bruise from prolonged severe pressure. We see it's non-blanchable with dark discoloration, usually red or purplish, and it feels spongy, and it looks something like this.